Betty, it's good to see you again. First of all, I have good news. You've done the right thing by coming in. After examining your x-rays and the results of the series of tests we did, I feel confident that what you have is treatable by chiropractic care. So, the good news is you're in the right place at the right time. Now, because this is a chiropractic problem, there's some important things I want you to know about chiropractic care. As you might remember from the DVD we had you watch, chiropractic is not new. It's not experimental. It has been the treatment choice for cases just like yours for over 100 years. In other words, if chiropractic had not been getting these such successful results, it would have disappeared a long time ago. But instead, the opposite is true. The results with chiropractic care have been so successful and so popular that it has now become the second largest health profession in the Western world. But the most important thing that I want you to know, and this will be pointed out in the report that I'm going to give you to take home, is that in a study done by WebMD of millions of patients over several years, chiropractic has a 95% satisfaction rate among patients. 95%, Betty. In the medical world of healthcare, it would be impossible to find results such as this, and such a success rate and such popularity. It would be impossible. So you can feel confident that you've come to the right place for the solution to your problem. Now, enough about chiropractic care. Let's get to the reasons that you come in. Why are you having pain? Why are you feeling this way? First of all, this was not the result of just one event. It wasn't that one twist or turn that you did that was wrong. And it wasn't that one improper lifting incident. Forget about all that. No, instead, this has been building up over the years. And it's the cumulative result of different lifestyle events that have just put stress on your spine and on your structure. So that's why I said it's not a one-time event. In fact, you may not believe this, but in fact, this began with birth trauma. Now think of, as a child and as a teenager, the numerous spills and falls you've had. Sports injuries. Now, add that to your current lifestyle as an adult. Betty, it would be impossible to know the number of traumas and improper lifting incidents that you've had just as an adult. That's why I'm saying again, it was not just one event. No, this has been building up over time. And now keep in mind, that's with virtually no treatment, no prevention, nothing to offset the wear and tear. So, as a result, your spine is taking a lot of pressure just from everyday life. Now think about it in these terms. Your teeth, for example. What if you never went to the dentist from birth until now, never brushed your teeth, never flossed? What condition do you think your teeth would be in? Another example. What if you had a car? Imagine a car with wheels that had never been properly aligned, tires had never been balanced or properly inflated. A blowout is inevitable. Now, let's go back to your spine. Over the years, you've had wear and tear that have caused an innumerable amount of nerve damage and tissue damage. Why, it's a wonder you're not in more pain than you really are. Not in more pain than you actually are right now. So what's the result of all of this? Okay, over the years, your spine has been pushed and pulled out of its proper alignment, and as a result, the disc have been squeezed closer together. And what that does is that narrows the openings that the spinal nerves come through, and that can cause swelling, irritation, stiffness, arthritis, and just it can irritate those nerves. Ultimately, it causes pinched nerves. And that's the condition we call subluxation. And what that means is that the nerves that are going to different organs and tissues of your spine have been pinched. And that cuts off the flow of communication. It stops the body from doing its normal job. The brain communicates back and forth between the organs, to the organs and the tissues. And that system also runs in reverse. And when these nerves get pinched, it stops that flow. Think of it as a water hose. What if you stepped on a water hose, or a water hose got kinked? It would stop that flow of water. So we've stopped the nerve flow. The subluxation stopped nerve flow between the brain, the nervous system, and the body. Okay, now look at this chart and you'll see that subluxations cause a number of different dis-eases. And I think you'll find this chart fascinating, so I want you to study this when you get home. Okay? And you also see that subluxations can cause much more than neck and back pain. Now, there are 4 phases of spinal degeneration, as you can see here. Just as other conditions that you may be more familiar with, like cancer, the longer you wait to treat it, the more severe the phase you're going to be in, and the more severe the health problems. So this is something we don't want to wait for. It's very important to start treating and preventing this right away. So, as you'll see, and I'm going to show you x-rays, I would place you right now in stage 3. Alright, let me show you your x-rays at this point so you'll see what I'm talking about. Since you can't take these x-rays with you, I'm going to circle these areas on your report that exemplifies your stage so you'll know exactly where you are and how important this is. See this, and this is subluxated here, and this is causing blood to be pinched. Do you understand? Okay. Alright. Okay, we've done enough. I think we've covered the cause of the condition enough. Let's move on to what's really important. What's important to you, and that's why you came here. The solution to your problem. Okay? Now, Betty, as I've already pointed out to you, your health problems have not been the result of just one event. You didn't do this yesterday. So likewise, we're not going to fix it in one day. What we're going to do is it's going to take a series of adjustments, what we call adjustments. And we're going to start adjusting your spine back into the proper alignment. Now, when an orthodontist looks at your teeth, they can't reach into your mouth and realign your teeth all in one day. No, it's going to take a series of treatments over time and to get those teeth back into alignment. So likewise with your spine. We're going to begin adjusting your spine, and frankly, it's going to unadjust itself right back out again. You see, your spine has been in that condition for so long that the body actually considers it normal. So in the beginning, it's going to be like 3 steps forward and 4 steps backwards. So that's why we have to get your spine retrained. And in order to get your spine retrained, there's some important things that I need you to do. First of all, you need to keep your prescribed appointments. Visits and adjustments to a T. Don't miss, so we can train your spine and get your health back. Okay? Can you see why that's important? The number of treatments and the timing of those treatments is very, very essential to care. So we've divided your treatment into 3 parts, and you'll see this right here. The first phase is obvious. Pain relief. We want to get you out of pain. Every person responds a little bit different based on their health status and their weight and their age. And but the first phase of care, it's going to be important to keep your appointments. The first phase of care, you're going to come in 3 times a week for 2 weeks. And we'll also be applying some therapies to supplement your care. I feel confident that at the end of this phase, you're going to be feeling good. You'll be out of pain and you're thinking, problem solved, I'm done. But Betty, that just isn't the case. Yes, we want to get you out of pain. But at this phase, your spine, your body is still so fragile, your condition is still so fragile that any wrong twist or turn, any improper lifting could set you back to where you are now or worse. And then we'd have to start all over again. So, the stabilization phase is even more important than the first phase. The goal is to get you stable to where you can do these things and not have to worry about coming in for 3 days a week anymore. So, that's why the second stage is more important than the first. So, before we graduate you to the stage, we're going to be doing a progress exam. And that will let us know if you're ready to move on to the stabilization phase. And at that time, we'll also be assessing whether you need less care than we originally thought. And if that's the case, we'll be anxious to do that for you. Okay? So, at this phase of treatment, it will be a little bit easier for you. You won't have to come in as often. At this phase of care, I want you to come twice a week for 3 weeks. And like I said, everyone's different, but at the end of this phase of care, I'm expecting you to be stabilized. But to make sure that's the case, we're going to do another progress exam just to see. Okay? Now, once we've done this progress exam and we've determined that you're stabilized, we're going to move you into the third phase of your treatment, and that is wellness care. Now, you may wonder, why is wellness care so essential? I mean, I'm out of pain and I'm stabilized. Why do I need to keep coming in? Okay. First of all, the one thing that we haven't done is to prevent the things that have caused this condition in the first place. We haven't stopped you from doing the things that have put pressure on your spine and wear and tear on your spine. Think of it this way. If you go to the dentist and you get your teeth cleaned and you get your teeth maintained, it would be nice if they stayed that way. However, in order for that to happen, you'd have to stop eating, and that's not going to happen. So, the result is you have to keep going back every 6 months to get them cleaned and maintained. So, likewise with the spine, we're not going to stop the activities that degenerated your skeletal system in the first place. So we wouldn't expect you to. We wouldn't expect you to stop these activities because you'd really have to be dead in order to stop these activities. But what we're going to do is provide a series of treatment over time to offset the wear and tear. So prevention is always wiser than overhaul, and wellness is always better than sickness care. So we will make recommendations. When you get to that point, we'll make recommendations accordingly. All right. So wellness is what you want, and wellness is what you need, and that's what we're going to provide. But in order to get you to that place, there's some things that we're going to need from you. I'll give you my best, but you need to participate in this too. We're partners here, so I'm going to need you to, first of all, keep your appointments just like in the other phases. Okay? What makes chiropractic work for you is the number of treatments, the frequency, and it's the same in all 3 phases. So it's just important in this phase to keep your appointments. Don't miss. Okay? Second of all, I'm going to need you to attend a special class that we have that is essential to your health and well-being, and also happens to be a topic that you will really enjoy and benefit from the rest of your life. It is called How to Stay Young, the First 100 Years. Now, I have tickets for you and your family. Because I think if your family were to come, they would greatly benefit from it too. And I promise you it's something you enjoy and something that you never heard taught before. Okay, so we have 2 times a week, Monday at 5:30, and if you can't make that, then we have a lunchtime at Wednesday at noon. Okay, which one of these times would be best for you? Okay, Wednesday at noon. Well, I'll put that down on your chart before you leave, and Sally will get you scheduled for all your appointments and your How to Stay Young class. Now, unless you have any questions for me, I'm ready to move on with treatment. Are you ready? Okay, very good.
Stop.